The 2025 Tuberculosis Day commemorations come at a critical moment for Kenya as the country grapples with significant funding cuts from the United States Agency for International Development, USAID, globally. Tuberculosis continues to be a devastating disease, infecting over 10 million people and claiming 1.3 million lives annually, according to the World Health Organization. Tonight on Heartbeat, NTV's health and science reporter Bridget Ngana investigates the impact of these USAID funding reductions and examines how health departments nationwide are scrambling to secure alternative resources to fill the resulting gap.
60-year-old Walter Thomas has lived for 20 years on TB medication. He has drug-resistant tuberculosis, and the free treatment and medication he has access to have been his lifeline.
Beleni zilikuwa na shida fulani. Kila kukojoa unapata kama umechanganyikiwa. Mkojo unatoka kama reddish, karibu same color. Ni sahi vile ishazoea na mwili haina shida. Beleni ilikuwa hata sasa sijui in case inaweza potea ama nyumba ichomeke, anything can happen. Watu unaweza sauna kwa gari ukitravel, unaweza tu hosi ukapewa zingine. Sasa hiyo ndio shida inaweza tokea.
Walter is fearful that the current reports of suspension of funding from the United States Agency for International Development could affect his future health-wise if nothing is done. He is also frustrated that the current government policies have not dedicated sufficient resources for healthcare.
Ati hiyo funding kutoka US ilikuwa ni tax ya Americans, ni tax. Si pesa ilikuwa tumeweka ati ni funding, ni tax ya Americans. Sisi pia tunakuwa taxed hapa. Tax yetu tunafanya hiyo kazi, inunua medicines, ilipe madaktari, na ijenge mazahanati. Na katiba inatuambia tupate affordable healthcare. Tupate affordable healthcare. Hizo nyumba bila afya na ataishi kwa hizo nyumba. Hizo nyumba mimi sitaki nyumba, lakini nataka afya. Mtu wangu ataka afya, jirani yangu nataka kuwe na afya.
Alafu utasikia tukikwambia ukute punzi ndani.
Walter is not alone. Similarly, at the radiology wing inside the Nakuru County Teaching and Referral Hospital, Peter Muturi gets a chest x-ray done.
So immediately we are done with taking the image, we send it.
The 90-year-old patient was recently diagnosed with tuberculosis at the Bahati Sub-County Hospital, but less than a week into treatment, he has developed complications.
Akapimwa tukaenda akatoa kikohozi, akapimwa ikasemekana ako na TB. Kwanza after 3 days ikawa kuna shida ingine. Ya hiyo TB imeleta shida ingine. Ndio tukarifariwa hapa, tukaambiwa tuendelee. Tukuje huku atolewe maji na aendelee na dawa za TB.
Muturi is among the 100 patients at this public hospital who undergo x-rays every day. 2 in every 5 x-rays conducted here are chest x-rays, which are key in determining whether a patient has tuberculosis or not.
The findings that you find on an x-ray vary, especially depending on the age. Then now the down part of our system, it only picks children from above 6 years and above. So they less than 6, we are not able to also pick them from our system. Those children mostly they will present with what we call adenopathy, like they will have more of lymph nodes within the certain parts of the lungs as compared to adults who may have lesions or signs that are within the lung parenchyma. So what do I mean? It's a bit maybe of technical. So for the kids they'll have some masses around this area, but for now an adult, this is the lung, the normal lungs, so they'll have things that are pointing out towards TB within the lungs.
According to Dr. Neema Barasa, the Nakuru County TB coordinator, they have been recording a rise in TB cases lately, especially drug-resistant tuberculosis.
TB is still very much a public health concern for our county. As of last year, we notified over 3,100 cases, and we are seeing a lot of also DRTB cases. This is the drug-resistant TB cases that are also emerging. Currently, we are managing 33 drug-resistant TB cases within the county, and we have patients who are as young as 11 months and spanning all the way to adulthood and later years. The TB that is circulating within the community that I think has been the biggest challenge in control, and that is an area where, as Nakuru County, we are trying to put in a lot of efforts, a lot of activities, a lot of funding and resources to curb the TB menace within the communities, even before these cases come to the hospital.
Nakuru West Sub-County has the highest burden of tuberculosis, and the county is just coming from a shortage of TB drugs in recent months. Nakuru has also lost TB specialized personnel due to the USAID funding cuts.
We are really focusing on early case detection, so because we know when you diagnose TB early, the prognosis is really good. You achieve cure. You cut the transmission of TB so that it doesn't happen a lot in the community.
Some of the concerns we had mainly was in terms of human resource. I think that has been our biggest challenge as a county, because a lot of our patients actually seen in specialized clinics, and a lot of these specialized clinics had a lot of partner staffing, but nonetheless we were able to integrate a lot of our treatment sites with the normal clinics and the normal outpatient clinics that we have. And from this, we were able to capacity build healthcare workers. Some time back, we had a bit of a challenge when it came to stocks of the patient packs. But currently, we have more than enough drugs to treat any patient that can come in any of our facilities. And even not just treating, we also have enough stock of the prevention drugs that we use, which we normally abbreviate as TPT. We have all these drugs available in store.
The National Tuberculosis, Leprosy and Lung Disease Program 2023 annual report indicates that Kenya recorded a total of 97,126 TB cases. 12,884 being reported in children aged 0 to 14 years, while adults aged 25 to 44 years accounting for 61,390 TB cases. TB treatment was free across public and private facilities because of the heavy donor funding it was accorded. But with the exit of USAID that contributed 25% to the national TB program, the shocks of that gap are already being felt across the country. But doctors remain optimistic that solutions will be found.
As a recommendation from the National TB Program guidelines is that all healthcare workers should be screened at least twice a year. And so this year we're also focusing on our healthcare workers, we're focusing on our communities, and we're focusing on getting all our defaulters back into care and to ensure that whoever is already in care stays in care until they're finished.
Tuberculosis, HIV and malaria are some of the infectious diseases that have been affected by the cuts in USAID funding. But here at the Nakuru County Teaching and Referral Hospital, patients who come in suffering from tuberculosis or any other chest condition are still able to get access to treatment. And that is the commitment of health workers here to ensure that they stop TB infections, most importantly, at the community level. Bridget, Ghana, NTV, Nakuru.